If you look to 20 to 25 years ago, or maybe a little bit more, 30 years ago, finding a shoulder specialist was incredibly difficult. There were only few doctors in the country that did shoulder replacements well. And in the younger generation, shoulder replacements is now the fastest growing replacement in the United States per capita, right? Obviously, we have our baby boomer population, and those patients require knee replacements and hip replacements. But the technology of shoulder replacements has really evolved over the last 20 years, and the education of how to do them correctly. So there's a larger number of shoulder specialists in the country. Both myself and Dr. Anderson perform shoulder replacements. We do a variety of different shoulder replacements for different reasons. Ways in which the technology has changed in the recent years is that, number one, we have a better understanding of balancing the shoulder. I think knee replacement and hip replacement has definitely been in the forefront of technology and of orthopedics in general. And now we have a clear understanding as to how to balance the rotator cuff, how to balance the capsule, and how to balance the length-tension relationship of the shoulder replacement. Within the two shoulder replacement worlds, there's the standard primary shoulder replacement for what we call primary glenohumeral arthritis, which is where you develop arthritis in the shoulder as either a genetic or positional reason or from work-life balance, things like that. And that is where we replace the ball with the ball and the cup with the cup, okay? The technology involved in those, in planning for those surgeries has increased. So in one way that we do them now is if patients have a very irregular cup in which the cup has worn away on the back side or the front side, we have ways of getting CT scans, running that through software programming, developing three-dimensional reconstructions, and then actually templating and placing the components in place and checking motion and balance within that realm. So for the harder primary shoulder replacements, it's very effective. In my practice specifically, I also use a more modern stemless component for primary glenohumeral replacements. And the reason why that has evolved is over in Europe, they've been utilizing this stem for over 15 years. And Europe, specifically France, is a very forefront thinkers with regards to shoulder replacement. All the great shoulder replacement specialists developed that technology there. And this stem has been there for a long period of time. The benefit of not having a stem in the shoulder is that it preserves bone. And so it gives us later bailouts if the patient needs a conversion later in life to what we call a reverse total shoulder replacement.